Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we will continue the technique for open extraction of single-rooted tooth. Today, we will learn how to create a purchase point in difficult extraction. This video will be followed by another video featuring multiple choice questions on the same topic. Please watch and understand this video first, then proceed to the next video for the MCQs. Furthermore, questions with answers on this topic for SEQ, VIVA, and OSCE will be available at the end of this presentation. In cases where the tooth remains difficult to extract after removing bone, a purchase point can be created. This involves making an indentation in the root with a burr at the most apical part of the bone removal area, as shown in this figure. It is important to minimize bone removal to preserve it for possible implant placement. If the tooth root is solid in bone, buccal bone can be removed and a purchase point can be made for insertion of the elevator with the help of a bar. The purchase point hole should be approximately 3 mm in diameter and sufficiently deep to allow the insertion of an instrument. A heavy elevator such as a crane pick is then used to elevate or lever the tooth from its socket as shown in this figure. This technique provides the necessary leverage to remove the stubborn tooth. A triangular elevator such as crane pick is inserted into the purchase point and the tooth is elevated from its socket. After the tooth is elevated, the soft tissue is repositioned and sutured as shown in the figure. Bone edges should be checked and smoothened with a bone file if they are sharp. It is advisable to avoid using a ronger since it tends to remove excessive bone in these situations. The flap is repositioned and sutured over intact bone. Once the tooth is extracted, the entire surgical field should be thoroughly irrigated with a copious amount of sterile saline. Special attention should be given to the most inferior portion of the flap where debris often settles, particularly in mandibular extractions. Failure to remove debris can result in delayed healing or a small subperiosteal abscess. The flap is then repositioned in its original place and sutured using 3-0 silk or chromic sutures. If the incision is properly planned and executed, the suture line will be supported by the healthy intact bone, facilitating optimal healing. Finally, take a look at the questions designed to help you prepare for different exams formats. Wish you best of luck.